if we're talking about more than 30% of burn, there's a lot of physiological changes that happen. First is an increased production of cytokines and inflammatory cell mediators that actually causes vascular changes. Vascular changes would be increase in permeability along the blood vessels that would cause extravasation of proteins into the surrounding tissue. That in itself would cause the fluid to come out. Problem is, at that particular point in time, there's other things that are happening also that coupled with that would cause tremendous problem that requires a lot more um, a lot of aggressive intervention. So initially you're going to have diuresis. Eventually the body tries to compensate for the fluid loss because as far as the body is concerned, it's losing a lot of fluids. So at that point, suddenly the kidney starts shutting down as it receives less perfusion from that. Now, and of course, you're all talking about how the heart is going to be affected. There's decreased contraction of the heart because especially as you produce a particular protein called tumor necrosis factor alpha. Decreased contraction, the vasoconstriction, and the catecholamines, the extravasation of fluids, would then lead to definitely a lot more problem in terms of making sure that dehydration does not take place. So IV fluid hydration is very important. It's also important to make sure that the patient receives a lot of nutrition because you're talking about, again, a lot more protein requirement and a lot more fluid that need to be replaced. And you need to correct all the electrolyte abnormalities. Of course, as you correct all those things, you need to make sure that also, as much as possible, you salvage any tissue that's salvageable from the burn. And those you could actually, as long as you maintain nutrition, as long as you prevent infection, as long as you increase fluid hydration and provide nutrition, then the patient probably will be okay.